UN Commission established by the UN Secretary General Ban Ki-moon to look at the question of the health. How could we employ more people through the health sector, given its size and its importance generally, and the manner in which also it relates and impacts to many other sectors as one way of tackling the unemployment kind of question. The feeling is that if we have a commission that could focus on it, we could in fact employ a lot of people.
This isn't just about creating more healthcare jobs in developing nations, it's also about increasing and stabilising economies as well, and that the two can be intertwined.
That's correct. That is the idea, but also try to prevent the health workers from the developing countries coming mainly to the developed countries, so that they can remain in their countries and therefore participate in terms of the work of the health in their own countries, and also make the developed countries to be conscious and have ways of creating the jobs for their own people, so that there will be no need for the people from developing countries to flood the developed countries. So it's going to be working for everybody, benefiting everybody in many ways, and changing, therefore, some of our policies and practices that we do that could disadvantage, particularly the developing countries.
How much of an issue in South Africa is that of the so-called brain drain? People, healthcare workers being trained in developing nations and then going to work in developing nations rather than staying back at home. Is that a big issue in South Africa?
It is a big issue for all developing countries. I think South Africa included, that we might differ in percentage. One of the problems, as you say, we are almost like subsidizing the developed countries. One of the problems is that we are busy saying, let us skill our labor force. Now, if you are skilling them, and as soon as they are skilled, they go away, it means you are almost trying to solve a problem that is like a mirage. And therefore, this is going to address the issue very definitely. It is a problem generally in the continent. It does affect South Africa.
You're co-chairing this UN Commission with the French President, François Hollande. What is it like working with him?
Well, it's very good. We are working with him very well. We know each other. We are co-chairing. We are not just co-chairing this, we are co-chairing also other things. And also we belong to some other organizations together. So it is very pleasant to work with President.